So starting with the first one, the plant poisons, I'm going to tell you a lot of mnemonics and tricks for those who have already watched the Sure Shot. This is going to be a quick revision for you guys as well. And for everyone who has joined for the first time for Sure Shot, you are going to learn a lot of tricks here. So identification of the plant poisons, toxicology is a very important part in FMT. So the first one that we have here, so where you have this red seeds with the black eye-like appearance, this is called as the eye jaisa appearance. This is the crab's eye. So you remember this as crabs is crabrus. Okay, crabs is crabrus, that is Abrus precatorius. Abrus, arbus nahi. This is Abrus precatorius is crabrus. So remember that is crab's eye. And precatorius, the other point to remember here, precatorius is prick. That means this is used as a needle, that is sui poison, a very frequently asked question. It is used as a sui, that is a cattle poison. Okay, sui or cattle poison. Abrus resembles, the abrus poisoning resembles viper. We know that viper VV is vasculotoxic. So remember, abrus resembles viper. It is vasculotoxic. Okay. Coming to the next seeds that we have here, which has a concave shape like the RBC, which has the concave shape. That is strychnine. Nux vomica, the poison being there, the active principle being strychnine. Nux vomica seeds, they are concave like the RBC. Remember, strychnine, S for S, is a spinal poison. Can you tell me strychnine resembles what condition? Remember, ST, similar to tetanus. Strychnine is ST, similar to tetanus. And in tetanus, we know that there are all the muscle contractions which happen. Your recent I9CT exam question, tetanospasmin in tetanus. Why do we get tetanus? Because of which neurotransmitter release? Is inhibited by tetanus? Right. Tetanus inhibits the GABA release, GABA glycine. It is presynaptic area where it acts. It inhibits the release here, presynaptic. So it is inhibitory neurotransmitter release. Everything becomes excited. While in strychnine, which is spinal poison, here also it is inhibiting the glycine, but this acts postsynaptic. Okay, remember strychnine, ST. Strychnine acts postsynaptic. So postsynaptic is strychnine. Presynaptic is tetanus. Okay. This is similar to tetanus. You will get here opisthotonus and rhizus sardonicus, the contraction of the muscles. All these are important images. Next one, very, very important, the seed which looks like a pen or a pencil. You know, the fountain pen, ink pen jo use karte the, which has the nib, or a pencil which is sharpened. So this looks like a pen or a pencil. So this is, we use the pen to make a mark. So what is this used for? Making artificial bruise, to make a mark. This is called as marking nut. So the seed, the nut which looks like this pen or pencil is the marking nut. Remember, MARC, marking is MARC in the semicarpus. MARC. Marking nut is semicarpus. The active principle is bilavanol. Okay, that is bilavanol is the active principle. This is used for making artificial bruise. Right? Going to the next one, aconite poisoning. Important. Aconite poisoning is what kind of poison? Where does it act? It's a cardiac poison. Okay, it's a cardiac poison. Very frequently asked question, which all plants are cardiac poison? Remember it as acorn is a dawn and has a queen. Acorn dawn has a queen, right? Which is cardiac poison. Acorn dawn has a queen. So this is acorn is aconite. Then you have digoxin. Okay, digoxin. Then you have here DON. Remember O for oleander, N for nicotine, and H for HCN, and Q for quinine, quinidine, that is cardiotoxic. Okay, cardiac poison. So oleander, nicotine are also, they are also cardiac poisons. Remember that point. So learning the aconite poisoning with the story here, after which you'll never forget the features of aconite poisoning. So remember that acorn dawn. So there was aconite in the month of December. So we all plan to go to aconite in the month of December. Why we are saying December? Because it is very chilled in the month of December. Imagine Delhi, very chilled in December. So we, all of us went to aconite. How did we go? We went on the bike. What did we wear? We wore the hoodie and we wore the helmet. Okay. Now we reached the concert. We are here. So, there are two groups of people always who will give mixed reaction to any concert, any class, any activity. Some of them will be happy. They'll have the smiling faces, and some of them will be sad. So this tells you basically that some of them find the concert very meether, very sweet, and some of them find it as a zeher, poisonous. So aconite is called as meetha zeher, a sweet poison. मीठा विष, मीठा जहर, sweet poison. किसी को मालूम भी नहीं पड़ेगा अगर आपने किसी को एकोनाइट दिया. So homicidal. Okay, very, very common, homicidal. So, and what is the poison here? What is the mechanism of action? People who are standing here close to the loudspeaker, the loud sound reaching the heart, causing arrhythmias, palpitations. It is a cardiac poison. It can cause AV block. And what do we use for AV block treatment? Atropine. Atropine is used in treatment of AV block. Okay. Now, when we are standing there, we are dancing in the concert, not just us who's dancing, it is also the pupils dancing. Pupils becoming big and small. Constricted, dilated. So you see hippus. Some of us standing for a long time in the concert, the weaker amongst us, we fall down because we get hypotension. Chakkar aane lagte hai, hypotension ho jata hai, right? Who were there in the concert? The males also and the females also. So wolves, males are wolves, right? You remember Wolffian duct is male reproductive duct ka. So wolf's bane and women's bane, that is the other name for aconite. Now in the concert, standing for a long time, we are hungry, we check out the food stalls and we see this interesting dish, which is steaming hot horseradish. Steaming hot horseradish. So looking at it, our mouth starts watering. So what is the feature in aconite? Hypersalivation. Look at the hypersalivation happening. So we get the steaming hot horseradish. Remember, aconite roots look like this horseradish. So we eat the steaming hot, we cannot wait. And you know that whenever we eat anything steaming hot, it leads to paresthesia of tongue and mouth. Okay, paresthesia of tongue and mouth is a very important feature that is given in aconite poisoning. Right? So what are the features here? Aconite, there's hypothermia or hyperthermia. Hypo, December month cold. There is hypothermia, hypotension, hypersalivation, paresthesia of tongue and mouth, called as monk's hood, devil's helmet, wolf's bane, women's bane. There is hippus, which is there. It's a meetha zeher. It's a cardiac poison. All these are the points that you need to remember for aconite. Okay. And look at the plant of aconite. This is how the plant looks like. The blue color is aconite plant. And look at the horseradish. The roots resemble the horseradish. It is the most toxic part of aconite. The entire plant is toxic, but it is horseradish. The roots resemble the horseradish, right? Is this clear with everyone? So paresthesia of tongue and mouth, and we have hypotension and hypothermia. Can someone tell me what plant is this? I've added few extra images and few extra tables in the book, guys. You'll get the PDF post class as well, so don't worry about that. The recorded class will also be available. Roots are the most poisonous mridula. Yes, very good. This plant here is Nerium, right? Nerium, oleander. Okay, red oleander, yellow oleander is what is we have. Nerium. What kind of poison is this? Oleander. This is also a cardiac poison. Okay, this is also a cardiac poison. Okay. Going to next one. What is this plant here? This plant which has the ... purpura जैसे appearance. Remember, purpura is Purpurea digitalis purpurea. Digitalis we know is cardiac, acts on the heart. It is cardiotoxic. The other name for digitalis is foxglove. Remember, in the digits, we wear the glove, right? Where do we wear the gloves? In the digits. So digitalis is foxglove, right? Coming to next one, the next plant here. Can someone tell me what is this? The seeds look like cockroach. Cockroach जैसे seeds is Ricinus communis. So for Ricinus communis, remember communis COCO has cockroach-like seeds. And remember the 3 C's here. Cockroach-like seeds, communis has castor oil is what we get out of it. Castor oil. And the plant looks like a cactus. Right? Like a red cactus will be your communis, Ricinus communis. The active principle here is ricin. The mechanism of action is inhibition of protein synthesis. Remember, it inhibits protein synthesis. Frequently asked question, that's the mechanism of action. Right? So remember the C and C for the Ricinus communis. That is castor oil. That is cockroach-like seeds. and that is cactus-like plant. These are the 3 C's for Ricinus communis. Next one here, this one which looks like a thorn, an apple thorn jaisa. This is the flower. This is Dhatura. Okay, this is the plant of Dhatura. Again, Dhatura, remember, looks like a cactus there. Okay, and Dhatura, the frequently given question says, a child while playing eats some fruits. That is the history given. This is your previously asked question. So that is Dhatura. Remember Dhatura ke liye the 9 Ds. One of that is dry. All the secretions are dry. There is delirium. When I say the secretions are dry, always remember that it means that it is anticholinergic. Dhatura is anticholinergic. It decreases the secretions. Always remember this mnemonic will come to your rescue. This mnemonic will come to your rescue, which is cholinergic. Cholinergic constricts and cholinergic contracts the smooth muscles, except the heart. So cholinergic will cause pupil constriction and the contraction of the muscles, leading to increased secretions. Okay, leading to increased secretions. So anticholinergic will be opposite. There'll be dilated pupil. So in the Dhatura ka D, please do add on, there is dilated pupil. It is all D, D, D in Dhatura. It is dilated pupil, very, very important. So there'll be decreased secretions. Can you tell me the opposite of Dhatura is which poison? It has cholinergic features, that is increased secretions. Farmer wala history rahega. Very good. That is OPC. So OPC will have pinpoint pupils and there'll be increased secretions. There'll be increased secretions, right? Very, very frequently asked in FMG, asked in NEET PG in all exams. The treatment antidote for Dhatura is physostigmine because it penetrates the brain. It is a friend of the brain. So physostigmine, mechanism of action, this is acetylcholine esterase inhibitor, will increase the acetylcholine levels and neutralize the anticholinergic effect of Dhatura. This crosses the blood-brain barrier. So physo is friend of the brain, crosses the blood-brain barrier. Even this image has been asked in one of the FMG exam. Guys, can you tell me what plant is this? This black color. Remember black color like the black in the night? Remember the black in the night? This is called as nightly shade, right? Nightly shade. And imagine someone doing belly dance at night. Belly dance, remember this is belladonna, Atropa belladonna. Okay, this is Atropa belladonna, black color belladonna, nightly shade. Okay, and what are the components, the principles here in Atropa belladonna? This is your FMG exam question. Atropa, as the term says, is atropine. So all anticholinergic. What is that? It is atropine, it is scopolamine, atropine, scopolamine, and hyoscyamin also. This was the question asked in FMG exam. So remember, this is hyoscyamin also, atropine, scopolamine, and hyoscyamin. This is anticholinergic features, similar to Dhatura jaise hoga, anticholinergic. Okay. And so this is the thorny wala appearance. This is Dhatura, right, which has these seeds here, which resemble the chili seeds. Okay, they resemble the chili seeds. Going to the next one, that is snake. In FMT, snake is something which is very, very important, right? Very, very important. You'll see it almost in every exam. First, the identification. Straight is straight. So where you see the straight bands, straight is straight. Where you have the diamond shaped marks, remember the diamond is made up of Seedha V and Ulta V. So that is viper is diamond shaped marks that you will have. Cobra is C. It will have a C like a hood. And so you will have in cobra, common cobra and king cobra. Remember, king cobra says, I am the king, I will not wear the spectacles. So no spectacle mark. Common man wears the spectacles. So spectacle present in common cobra, no spectacle in king cobra. The spectacle mark is also called as binocellate mark. Okay, binocellate mark. So look at this image where you have this binocellate mark, these two black colored marks here. That is the common cobra. Okay, that is the common cobra, right? And where there's a hood, there's no marking there, spectacle mark, that's going to be the king cobra. Okay, that's going to be king cobra. So if I ask you that out of these snakes, the crate, the viper, and the cobra, which one has the minimum fatal dose? Which one has the minimum fatal dose? Yes. Yes. Remember, it is crate. So for crate, you should remember that crate is straight bands. Remember all the straight for crate. Crate will have straight bands. Crate goes and acts straight. No time pass. What does crate do? Crate goes in the body directly without causing any local reaction. So remember, it goes straight into the body. That means it has minimum or no local reaction, and it goes and acts straight. That means it has minimum fatal dose. So crate is like straight, targeted, very, very targeted. I just want to do the poison thing and nothing else. So go straight in the body, minimum local reaction, minimum fatal dose, and it has straight bands. What kind of poison is it, the crate poison? Like the cobra, it is neurotoxic. So remember that cobra and crate, the wale cobra and crate affect the CNS. That means they are neurotoxic. Now, in the question, they do not give you that neurotoxic, which is the neurotoxic snake. How do they give you the neurotoxic, or how do they mention the neurotoxic is? Basically, there is a respiratory muscle weakness, or there are convulsions. Remember, convulsions are seen with cobra, C-O-C-O. Cobra shows convulsions. Crate does not show convulsions. Okay? Like the drooping of the eyelids, muscle weakness, respiratory muscle weakness, all these are the features given for neurotoxic. Viper, remember, VV is vasculotoxic, hemotoxic. So the clotting time will increase with Viper. And you should not use a tourniquet with Viper. Right? Why? Because it can cause local necrosis. There can be local necrosis. Sea snake, imagine going into the sea and swimming. After swimming, you get a lot of muscle ache. So sea snake is myotoxic. Okay, sea snake is myotoxic, right? So this is about the snake identification. Coming to poisonous versus non-poisonous snakes. Poisonous snakes are identified by the belly marks, which are large or which are small. The belly scales are large in poisonous. So imagine like a poisonous person who holds all the poison in the belly. You know, all the secrets, all the poison in the belly, right? And when do they throw out all the poison? At night. Okay, at night. So these are the poisonous ones are nocturnal. The belly scales are large. Tummy mein sab poison hai. Of course, they will have the fang marks. The fangs are going to be canalized because that is where the poison will come out through the canalized fangs. Okay. So belly large hai, aage aur piche, head scales or tail chota chota hai. So head scales are small, tail is compressed in the poisonous snake. Exception, remember this cobra. Cobra C is the third alphabet. Third labial is largest in the cobra. C, cobra, third is the largest. In crate, fourth is the largest. Okay, in crate, fourth is the largest. Okay. You have the right approach for snake bite. Remember the full form of right is reassurance, immobilization, get to the hospital and tell the doctor. Important point to be noticed here. I is not incision or suction. T is not tourniquet. The tourniquet can decrease the arterial blood supply and lead to ischemia. It is contraindicated in Viper for sure. Do not wash the bite here, the snake bite, and no incision, no suction, right? Remember reassurance, immobilization, and you have get to hospital and it is tell the doctors. The anti-snake venom that we have, it's a polyvalent. India mein jo hai against the 4 big snakes. And we give 10 vials IV without the test dose. Okay, we give 10 vials IV of anti-snake venom without the test dose, right? So this is what you need to know for the snakes. The next one here, scorpion is something which is asked so frequently in exam. So remember, scorpion is similar to cobra. Okay, so remember this as SC in scorpion. What is the SC in scorpion? It is similar to cobra. That means similar to snake bite. SC means for sympathetic and cholinergic. There can be sympathetic crisis. There can be cholinergic crisis. So sympathetic cholinergic overreactive in scorpion. What do you give in the treatment? P for prazosin. Okay, P for prazosin. So you have prazosin here, sympathetic cholinergic overreactivity, autonomic crisis. So you give prazosin. which is a alpha 1 blocker, sympathetic blocker. Okay. Autonomic crisis is very important here. And an autonomic crisis mein, they can give you something related to sweating, because sweating is autonomic. I hope you know that sweating is sympathetic, that is sympathetic system, but mediated by acetylcholine. This is what we have already seen. Crate acts crate, minimum local reaction and minimum fatal dose is for crate. Okay, not for the cobra, but for the crate. Everybody is done with this. Give me a quick thumbs up if this is clear with everyone. Right, so we are done with the plant poisons and we are done with the animal poisons. यहाँ पे एक animal में ये याद रखना, Spanish fly. ये जो green color का है, cantharidin is the active principle. It causes priapism and vesicles. Okay, right. Going to next one, that is metallic poison. Very important. That is arsenic. Okay, this is so frequently asked, arsenic. Never forget the story of arsenic. You will never forget the features of arsenic poisoning. You don't have to revise them. So this is the story of the hippie girl called Marsh Wrench Gutsy. She's a very gutsy girl. She always wants to go out no matter what is happening outside. Whether there is earthquake, there is rains, she wants to go out. So Marsh Wrench Gutsy is getting ready to go out. She wears the black footwear. You cannot see the black footwear because of this bell bottom hiding that black footwear. Okay. So black footwear, it causes black foot disease. She puts the nail paint, that is Mies lines on the nails. She puts mehendi, hyperkeratosis. She goes out in the rain. The rain falling on her gives the raindrop pigmentation. She reaches a favorite restaurant and she orders garlic noodles. She loves garlic noodles. Then after the main course in the dessert, she orders red velvet cake. After that, she drinks water. Unfortunately, the water is contaminated, so she gets cholera. So remember, it has garlic odor, red velvet stomach appearance, and cholera. It resembles cholera. So remember, cholera matlab, this will resemble gastroenteritis, right? There'll be gastroenteritis, diarrhea, vomiting will come with arsenic. Okay. In the acute poisoning, it affects the liver, causes yellow or fatty liver. In the chronic, remember bones. So in heavy metal poisoning, bones need to be preserved, right? In the heavy metal poisoning, bones need to be preserved. Remember, this delays putrefaction and basically promotes here mummification. So remember, arsenic, ye jo hai, jo Marsh Wrench Gutsy hai, she dies and becomes like a mummy. So mummification is what will be there. So look at the images here. This is hyperkeratosis, mehendi-like appearance of arsenic. This is raindrop pigmentation happening. Okay, so this is arsenic. So Marsh Wrench Gutsy test, blackfoot, hyperkeratosis, Mies lines, raindrop, garlic, red velvet, and cholera. Remember, it can cause neuropathy as well, the motor sensory neuropathy. Okay, the motor sensory neuropathy. One of the questions which was asked in the exam, I'll come to it when we discuss mercury as well. It can affect the PCT, but it will have vomiting also. Arsenic will have vomiting. Coming to lead poisoning, before that, what is the antidote for arsenic poisoning? Remember, it is BAL. Okay, BAL, that is dimercaprol, or specifically, if they ask the specific antidote, you can go for, in the option, if you have freshly prepared hydrated ferric oxide. Okay, freshly prepared hydrated ferric oxide is used for arsenic. So you can remember this as this girl who got cholera and it was raining so heavily. So a ferry comes to take her and get her to the hospital. So ferry in the water, ferric oxide is for arsenic. Going to lead poisoning, very important. Remember, the other name for lead poisoning has been asked in NEET PG and FMG also. It is Saturnism. Okay, this is Saturnism, or what is the symbol for lead? Pb. So it is also called as plumbism. Saturnism, plumbism. For lead, Pb, remember the 3B. Pb is 3B. What are the 3Bs? The bands, the metaphyseal bands, basophilic stippling, and the blue or the Burtonian line on the gums. So please remember that this is the dense metaphyseal bands. You know what is the advantage of attending this live or watching the videos of Sure Shot is, I will specifically tell you the points which are to be remembered, the small points which we generally tend to make mistakes on and which we might neglect when we do the self-study. But right, having gone through so many years papers and you know, been teaching since so many years, so we know that where are the areas where the questions can be asked and where are the areas where we can make a mistake and we might miss it if we do the self-study. So please highlight all the points which I tell you that this is important. So remember that in lead poisoning, you have dense metaphyseal bands, not lucent. So look at this one. Dense matlab white. In radiology, dense means white. You will see the dense metaphyseal bands, not lucent. Lucent is seen in leukemia. Okay. This is the basophilic stippling, blue color basophilic stippling, and the Burtonian line. Okay, Burtonian line. So this is the 3B. Why do you get basophilic stippling? In which other anemia do you get that basophilic stippling wala appearance? Basophilic stippling appearance? Priyanka, that exactly came so bada. Yes, Venkat Lakshmi, we are going to do that. I'll share the PDF in the new app also. Megaloblastic में दिखता है stippling. Megaloblastic में तो hyper segmented neutrophils दिखेंगे. और दूसरा कौन सा है more important? Remember, sideroblastic anemia. Sideroblastic anemia. So wherever there is a problem with the heme synthesis, sideroblastic anemia, heme synthesis problem, lead poisoning affecting the heme. So there is going to be this stippling which is there. So very, very important question. Never ever forget this, that lead inhibits what enzyme in heme synthesis? So remember lead. Lead is LEAD. So it inhibits your ALAD. ALA dehydratase. ALAD is lead. Lead inhibits LA dehydratase, not synthase. Plus it inhibits your ferrochelatase. ELA, LEA, lead. It inhibits two enzymes. What levels does it increase? It increases the activity of ALA synthase because the heme is not getting synthesized. So the rate limiting enzyme ALA synthase will get overactivated. So it increases ALA synthase, inhibits ALA dehydratase and ferrochelatase. Very, very important. Generally, the history that you get in lead poisoning. Remember the old house, because previously old house wall paint जो होता था उसमें lead रहता था. So old house, wall paint, all that history will point toward lead poisoning. Okay. The mnemonic, the other features of lead poisoning, remember the mnemonic is lead. We lead our children, parents, teachers lead our children by teaching them A, B, C, D, E, F, G. A, B, C, D, E, F, G is your mnemonic for lead poisoning. A is anemia, B is the 3B, C is colic constipation, that's the clinical feature. D is drop, wrist drop, foot drop, so motor neuropathies. E is encephalopathy, commonly seen in children. F is facial pallor and G is gout. Saturnine gout. Gout, Saturnism, lead, Saturnine gout. Okay. Remember, all these are the features for lead. What is the antidote for lead? LEAD is EDTA. Okay, we use EDTA for lead poisoning. EDTA. Okay, EDTA. Right? Clear with everyone? Yes. Coming to mercury poisoning. What is the symbol for mercury? The symbol for mercury is Hg. Okay, how do we denote mercury? Is Hg. So remember, it is Hatter's shake and glass blower's shake. So Hg, the symbol tells you that there is Hatter's shake or glass blower's shake, also called as Denbury tremors. The shake is the shaking, the tremors. So what do we see in mercury poisoning and tremors? These occupation, glass blowing, Hatters, is where the mercury exposure is there. So mercury ka mnemonic is, remember mercury, M-E-R, and you have C there. M for Minamata disease, organic mercury consumption by eating of fish. Minamata is mercury. ER is erethism, right? Erethism, mental aggressiveness vagera. So that is erethism. Then is, read this ulta REM, that is tremors. We have already said Hatters and glass blowers shake. And C for convoluted tubule necrosis. Remember, it causes PCT necrosis, frequently asked question. That means it is nephrotoxic. Arsenic also can cause that, like we said, but there will be vomiting with arsenic. That's one of your NEET PG FMG exam question. Okay. So mercurial lentis, erethism. Another point important here is acrodynia in meats. Acro, anywhere acro means distal limb. So look at the distal limb here. Acrodynia, they have become pink. This is called as pink disease. Pink disease, acrodynia is mercury. There is salivation, PCT necrosis, it is nephrotoxic, and Minamata disease. So remember, this is pink disease, Minamata disease, PCT necrosis, all this is mercury. Okay. Coming to next one. So we are done with the poison wala part. That is basically your plant poison, animal, and the heavy metal poison, right? And a few important points to be added because there was this question in your recent I9CT exam also. Rodenticide, and the question mentions hypokalemia. This was asked in the I9CT exam. Remember, this is barium carbonate. Okay, this is barium carbonate causes hypokalemia. Important. This was the question asked. Next important question asked, loss of eyebrows. Right? Loss of eyebrows, alopecia, all these are features seen with what poisoning? Loss of eyebrows. Very good. Remember it as, imagine the photo of Thanos. Kaisa hai Thanos? Ekdam takla hai, no hair. And imagine the loss of eyebrows. So Thanos is thallium. Okay, thallium is Thanos. Okay, thallium is Thanos. Next one that you have, luminescent stools. Luminescent stools is seen with luminescent stools. Very good. That is phosphorus. Which phosphorus is poisonous, red or white? It is white phosphorus. White phosphorus, luminescent stools, phossy jaw. Okay, remember the jaw bones are affected. Phossy jaw, luminescent stools is phosphorus. Okay, important. And where do you have a lobster jaisa hand? Lobster wala? Lobster, very good. That is boric acid. Okay, that is your boric acid. That is lobster. Okay. So this is, so you can remember boric acid boils lobster is what you will get with boric acid. Boils, boric is boil. Going to next one, the drug abuse methods. This is very frequently asked in FMG exam with the images, right? So first one, what is this method of consuming the drug? Is it sniffing? Is it snorting? Is it bagging? Is it huffing? So when we are using handkerchief, remember handkerchief, using the handkerchief to take the drug is huffing. HH, handkerchief is huffing. This is a bagging. Previously FMG exam question, bag use kar rahe hai. So what is huffing? Is using a cloth, that is basically handkerchief. Remember cloth or rag. Bagging is using a bag. And what is sniffing? Sniffing is basically you have liquid and from there you are inhaling the fumes. Sniffing is liquid. Okay, sniffing is liquid. This was also the image asked in the exam, right? When you see this very well defined palate-like things in the rectum or a previously asked image, it could be in the stomach also. It could be either ingested or it could be through the rectal route. So smuggling of the drugs, basically this is body packer. Okay, this is body packer, drug smuggling. All this is showing you the body packer. Okay, drug smuggling wala. Going to next one, the antidotes we have discussed for arsenic is bal, yeah, ferric oxide, taking in the ferry. For lead, ED, it is EDTA. For dhatura poisoning, remember dhatura is physostigmine. This is acetylcholinesterase inhibitor. For carbon monoxide, it is oxygen. Carbon monoxide binds to hemoglobin, does not allow oxygen to bind. So we give more oxygen. Okay, we give more oxygen. For cyanide, this was asked in your I9CT exam. Cyanide poisoning ke liye, the drug of choice is hydroxycobalamine, not methylcobalamine. Or so remember, this is hydroxy. You can remember it as hydroxy water. It converts cyanide into more water soluble form and takes it out of the body. So remember, this is hydroxycobalamine, not methylcobalamine or cyanocobalamin. And you have the Lilly's kit, which has nitrite. I9CT exam question, what nitrite do you have and what other component? You have amyl nitrite. What else do you have? Sodium nitrite, Multiple options correct question was there. Amyl nitrite, sodium nitrite, and sodium thiosulfate. Okay, sodium thiosulfate. Amyl nitrite, sodium nitrite, and sodium thiosulfate. You know, guys, that is the power of MCQ solving. Once you solve the MCQ like you did in the INICET exam, and if you made an error there, you will never forget that. You know, I still remember what mistakes, what questions I did wrong when I gave my PG entrance exam. So that's the power of solving the MCQs. So you should never underestimate that, and you should never run away from that. MCQs actually help you to remember the stuff better, and they help you thinking. The critical thinking comes only with MCQs. So do that more in this last month. For morphine, it is naloxone. Remember acute poisoning of opioid, we give morphine. Remember opioids, they cause respiratory depression. Okay, respiratory depression. The question will mention what are the pupils? Dilated pupils, constricted pupils. What do you get with opioids, morphine? Is it dilated or is it constricted? Pinpoint pupils. Remember the 3 C's: constricted pupils, coma, and constipation. Right? The pupil is constricted. For iron, remember all the fair is iron: desferrioxamine, deferriprone, deferracerox. All this is for iron. Wherever you see the FER, this is very, very favorite for FMG exam. Okay? Methanol ke liye, remember methanol, MEME is fomepizole. Methanol is fomepizole. Okay? Right? So let's carry on from here. Okay? So we were on this table of the antidotes, and what were we seeing here is methanol is fomepizole and ethanol. Okay? So fomepizole or ethanol, remember what enzyme do they inhibit? They inhibit alcohol dehydrogenase and not aldehyde dehydrogenase. All the points, like I told you, are the points to be noted down. Silly mistakes, small mistakes that we tend to make. Remember, on the other hand, disulfiram that is used. Disulfiram is alde. It inhibits aldehyde dehydrogenase. Fomepizole ethanol is alcohol dehydrogenase. Okay? And next one that we are talking about is heparin. For heparin, it is protamine sulfate. We will see this in pharmacology also. What kind of antagonism example is this? So for anybody who has watched the Sure Shot, if you know this. Very good, guys. Amazing. It is a type of chemical antagonism where the antagonist binds to the chemical itself. Okay, so it binds to the chemical itself, not to the receptor. Protamine binds to heparin itself. It's an example of chemical antagonism. Remember, BAL is given in heavy metal poisoning, except what should you not give in BAL bachas? What should you not give in BAL bachas is Cadbury. So cadmium, Cadbury and iron. Okay, Cadbury and iron. Next table here, acetaminophen, which is paracetamol, very frequently asked, N-acetylcysteine. You know that cysteine is a very important active amino acid in which compound which helps us tackle the oxidative stress, that is glutathione. Okay, that is glutathione. So N-acetylcysteine, this was your INICET exam question. Acetaminophen produces your NADPQ, ऐसा कुछ product था, which I don't remember the exact name. So in which compound metabolism you get this compound? NAPQI. Thank you so much for reminding me. You know, that's a trick that you should learn. So to crack the exams, you do not need to remember entire thing, but ऐसा कुछ तो था कि NADPQ ऐसा कुछ था, exam में आया, I'll be able to answer. So thankfully, it's not a Viva exam where I have to remember everything of that. I at least remember this much. It will help me to crack the exam, right? So that's a very important trick. Next one, anticholinergics, that is Datura or atropine. Remember, we said it is physostigmine. OPCs, remember, atropine is used in treatment. Atropine. Remember, atropine is treatment of OPC. The term itself helps you to remember that. It is treatment of OPC. Okay. Along with that, you need to give pralidoxim, early pralidoxim before the enzyme dies. Pralidoxim is the enzyme reactivator. It's like a reviver, giving the CPR to the enzyme. So you have to do it early. Okay. Next one, benzodiazepine. Diaze is flumaze. So do not confuse this with fomepizole. Fome is methanol and this is diaze. Carbon monoxide is oxygen. Cyanide is sodium nitrite, sodium thiosulfate, hydroxycobalamine. Heavy metals is chelating agents, methanol, and even ethylene glycol. It is fomepizole. What history you have in ethylene glycol? Oxaluria. oxalate crystals. Very, very important. Antifreeze, ethylene glycol, and oxalate crystals. For opioids, naloxone. For snake, it is antivenom. Okay. Coming to IPCs, very, very important, a favorite mnemonics area in FMT. Stick to the old IPCs. You do not need to go into details of BNS for your exam. It's not yet implemented. Still, there's controversy going on. Supreme Court saying ye dena hai, ye nahi dena hai. So I believe abhi ke liye for this year, you should stick to the old IPCs only. Right? Perjury definition, perjury punishment. Very, 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 very important. Perjury definition, when the person says, I know none. Mujhe kuch nahi pata about the incidents, even when I know that, that is perjury. So I know none. I is one, no is no, and none is one. So 191. If anybody does perjury, he will have to pay a fee. Fee is 3, rhyming with 3. So fee is 3, 193 is punishment. False certificate, remember certificate is certificate, you can write an SE, 197, SE. Intoxication, involuntary, voluntary. Involuntary means I did not do it out of my choice, I was forced. So forced intoxication, F forced is 585. And when it is self-intoxication, out of self-choice, voluntary is self-choice, remember it is 6. So when it is self-choice, I'll be responsible for it. When I am forced, I will not be responsible for it. So remember, 85 is forced, not viable. 86 is self, that is voluntary and responsible. McNaughton's rule is for the foul mind. Remember, foul is 4, it is 84. McNaughton's is foul mind, 84. What other rules do you have related to insanity? The foul mind और कौन से rules होते हैं? Yes. The Curran's rule and the Durham's rule. Okay, Curran's and Durham. Remember McNaughton, Curran's and Durham. This is foul mind. So this is, you can remember as McDonald, McD is foul mind, insane mind, MCD, McNaughton's, Curran's and Durham's. Okay? Next one, invalid consent. Like if you take a consent in someone who's less than 12 years under intoxication, forced consent, all this is invalid. Invalid matlab zero value. So 90 is invalid null consent. 92 stands for nahi do, nahi do. Nahi do consent, do not give consent, even then it is fine. I'm going to operate on you because I want to save your life. So this is a doctor can operate in emergency without consent if it is life-saving. So this is nahi do 92. Coming to rape ke IPCs, definition, remember definition is 375. Punishment is giving the sticks, that is 376. So definition 5 and sticks is 376. 376A is affected for lifetime. The victim is affected for lifetime, going into vegetative state or dying. So that is 376A. 376B for BV. So with the wife during the separation. C is by someone who's in custody or in chair, that is authority. D is Don. Don ka kya hota hai? Gang. So gang rape is D. And E is an expert rapist. That means repeated offender. That's how you remember. Affected for lifetime, BV, custody, Don, gang rape, and E, expert. Out of this, which is bailable? Only 376B is bailable, rest are non-bailable. You know, the wife will get very emotional and say, nahi, nahi, mere husband ko chhod do, my pati Parmeshwar, please leave him. It is not his mistake. So that is only bailable. The rest are non-bailable. Next, what we have is non-consensual, unnatural sexual offenses. That is 377. Okay, that is 377. So, 377. I mean, I'm sorry, some mnemonics have to be in Hindi. Right, that comes very involuntarily for me, right? So I am not responsible for that. So 377. So 377, agar 3 log are doing it साथ, it is unnatural sexual offense. So 377. Dying declaration and expert witness. So remember, it is dying declaration is a dying number, a number which is falling down. 3, 2. Expert witness is upscaling. So a number which is upgoing, that is 45. So dying declaration 32 and expert witness is 45. This is where I wanted to clear some points. This is a previously asked topic. We have not discussed this before. That is dying declaration and dying deposition. What is the difference in between the two? So dying declaration versus dying deposition. Which one has more value? Which one has more value? I hope this is not stuck for everybody, guys. Only, right. It is dying deposition. Okay, it is deposition which has a greater value. So look at the difference between the two. The dying deposition which has a greater value, so it has to be always recorded by the magistrate. The oath will have to be taken, right? This is superior to dying declaration. The statement is always recorded in the presence of the accused or the accused or his lawyer, and cross-examination is allowed, right? And this retains a full legal value even if the person survives, because everything has been done by procedure. The oath has been taken, there's cross-examination, the accused is present or the lawyer is present, it is the magistrate. So remember all these formal points, the legal points, this is all done very legally. So it has more value. So even if the person survives, it will retain the value. Dying declaration is just a declaration that a person is doing. So it can be recorded by magistrate, doctor, investing officer, anybody. There is no oath, so the person can tell anything. Kisi ka dar nahi hai. It is inferior to dying deposition. The accused or his lawyer is not necessary while recording. There's no cross-examination. So if the patient survives, it loses its value because it is just a declaration. है ना, बोल जाने के पहले कुछ बोल के जाओ. So, if you want to take somebody's revenge, but if you survive, nobody will believe on whatever you have said. So remember, declaration is just declaring. This is what I declare, right? I mean, it is my choice. Nobody else, कोई magistrate कोई नहीं चाहिए, accused भी नहीं चाहिए, oath भी नहीं चाहिए, कुछ नहीं चाहिए. ठीक है? Right. So remember, this is the difference between the two. And going to the next point. Causing disappearance of evidence of offense, frequently asked question if the doctor does embalming before the autopsy. So that loses the evidence of any poison or anything. So this is 201. In the mnemonics for IPC, 2 is a naughty person. 0 matlab nullifying the evidence, disappearing the evidence. So 201 is causing disappearance of evidence, embalming. Then you have for vitriolage, what is the IPC? Vitriolage is acid throwing. Remember, acid is as6. So that is 326. As6, it is 326. Hurt and grievous hurt. Hurt is 319. Grievous hurt is 0. जहाँ पे 0 आता है, that becomes more weightage, right? Grievous matlab 320. Murder matlab or grievous, that is 300. So murder will be 300, which is more grievous, and grievous is only 320. In grievous hurt, this is important, and add these points we have not discussed previously. In the short 320 IPC, emasculation comes here. Not able to go to work for how many days is considered as grievous hurt? It is 20 days. Okay, 20 days. So person not able to do daily activities, 20 days. Next, you have vision gone, hearing gone, face का कुछ disfigurement हो रहा है, even a fracture or a dislocation of tooth also comes in your basically grievous hurt. Okay, all this comes under your grievous hurt. So vision, hearing, face disfigurement, 20 days is what you need to remember. Tooth is what you need to remember. This is where the questions are generally formed, and emasculation. Coming to next one, that is murder definition and criminal abortion first. 312, 313 and 314, your recent NEET PG exam question. So 312 is the 313131 is constant. 2 is when the mother is saying, I want the family of 2 only, I don't want my kid, मैं और मेरा husband. So this is with consent, abortion with consent. 313 is where the mother is saying, no, I want a family of 3 only. So that is without consent. And 314 is where there is foul play. 4 is foul, like 84 is foul mind. So foul play leading to the death of the mother is 314. This is your NEET PG exam question. NPG stands for NEET PG. Okay. Murder definition 300, murder punishment, Dafa 302 ke tahat, the Hindi movies say it very often. Punishment is given 302. Police inquest and magistrate inquest. Remember, inquest comes under CRPC, not under IPC. You are not giving punishment to police and magistrate. It is criminal procedure code. So CRPC 174, 176. Remember, it has magics. Magis is magics. It is 176. Similar to ASICS, which is 326. This is MAGICS, which is 176. Police usse chota number magistrate se, it is 174. Magistrate inquest is done in a case of dowry death. In case of exhumation, it has to be magistrate. In case of death in custody, it has to be magistrate. Okay. Punishment for revealing the identity of the rape victim. So again, this two notorious person comes who goes to 8 people. Naughty 2 goes to 8 people. 2 to 8 people and tells the identity. That is 228. Okay, that is 228. Examination of accused by the doctor, which can be done even without consent. Remember, for accused, the consent is not required. Versus for victim, the rape victim examination, a consent is a must. You need a consent in that case, right? Less than 18 years, the guardian needs to give the consent. And so this is CRPC 53. 5 and 3. The doctor and the accused are facing towards each other. 5 and 3. Look at the numbers facing towards each other. Okay. And another question, that when you are examining the accused, what stain do we use in that case? For accused, it is Lugol's iodine. Right? To look for the glycogen in the vaginal cells, the Locard principle of exchange. Even there has been a question on this as well. Okay, when two things come in contact, there's going to be exchange of the material. So Locard principle of exchange. So for the vaginal glycogen cells, Lugol's iodine. And when you are examining the victim, what dye? Remember, it is TV. Toluidine blue is for victim and Lugol's iodine is for the accused. Okay, important. Coming to next one, now homicide, medical negligence, dowry death, 304A, 304B. A is apron medical negligence, B is BV wala dowry death. So dowry death is death within 7 years, right? And here also it has to be magistrate inquest. Next is abandonment of infant or newborn. You are abandoning the infant or newborn for heaven's sake. Heaven ke bharose, Bhagwan ke bharose. Remember, heaven is 7. This is going to be 317. Okay, this is 317. Implied consent, that means no consent is required. Nahi do is 92. Nahi do is 92. Next one, if a pregnant female, a female who has been given the hanging का कुछ दिया है, life sentence कुछ मिला है, and it can be postponed if the female is pregnant. It is what CRPC there? What CRPC? A female if it is pregnant. Implied consent means the consent is implied. You don't need to take the consent. Very good. That is 416. 1 matlab none and 6 matlab sticks. So none sticks to be given to a pregnant female. That is what you should remember. This is 416. Okay, 416. Coming to some very, very important points, especially for FMG exam, the MTP Act is like very, very frequently asked. So some amendments in the MTP Act 2021. According to that, even the unmarried females are included. Previously, it was only to married females. And in a case of rape victim, the MTP can be done till 24 weeks. In a case of contraceptive failure, does contraceptive failure come under the ground for abortion, MTP? Yes. What ground? Social ground. Okay, that is the social ground. So that is to be done only till 20 weeks. 24 weeks is for rape victims, survivors. And after 24 weeks, if there's a gross congenital anomaly, after 24 weeks, it is only for the anomalies, and we will need approval from the medical board. The state level medical board approval is required. Now, 1 RMP versus 2 RMP. Previously, it was 1 till 12 and 2 till 20. Now it is 20 and 24. So up to 20, only 1 RMP is required. So it is the general, the weeks, the 20 weeks, only 1 RMP. Beyond the 20 weeks till 24 weeks, it is 2 RMP. And beyond 24 weeks, it is the medical board approval. Right? Is this clear with everyone? Please remember these points for MTP Act. These are very, very important. 20 weeks तक एक ही, 20 के बाद 2 लगेंगे. Till 24 and 24 के बाद medical board. Contraceptive is social ground, 20 weeks only. Rape victim is 24 weeks. Okay. So this is done. Going to the next part, hanging versus strangulation. Remember it as hanging. Very, very important point for ante-mortem hanging. How do we know that the hanging is ante-mortem? By the saliva hanging. The saliva hanging is ante-mortem. So remember, saliva hanging is ante-mortem. La facie sympathetic, carotid tear, de-Moussat sign, all that is ante-mortem hanging. Hanging also has a knot which is hanging. That means it is like a vertically oblique knot. And strangulation. Remember strangulation, STRA. What do you mean the mnemonic here for strangulation is? TRA helps you to remember it's a transverse ligature mark. It is horizontal and it is complete. And S helps you to remember there's a lot of stagnation. That means a lot of blood, congestion, stagnation is the key word given in strangulation. So stagnation and transverse mark is strangulation. Typical hanging, atypical hanging, complete hanging, incomplete hanging. The typical hanging is based on the knot position. Typical hanging is based on the knot position. If it is at the occiput, it is typical. Otherwise, it is atypical. Complete hanging means it is off the ground. The entire body is off the ground. Incomplete means some part is touching the ground. So one of the question asked in FMG exam was, in which hanging? It is the weight of the head and the upper limbs which is responsible for the constricting force, complete hanging. Head and upper limb. Okay, when the person is completely hanging, it is the head and the upper limb which is the constrictive force. Okay, I'll post the annotated PDF, don't worry. Judicial hanging should ideally come under atypical because उसका knot इधर ear के इधर होता है. It is not here. ठीक है, occiput में नहीं होता. Next one that we have here is hanging. We have already said it's a oblique and incomplete. This is transverse complete. There's a lot of congestion. That is stagnation. Hyoid fracture, thyroid cartilage fracture, more than the ligature. That is hanging, strangulation wala ligature. These are more seen with manual. Okay, the manual ones hand से करते हैं तब ज़्यादा fracture होता है rather than the ligature. The manual ones cause more fracture. Hyoid, H for hanging. Still, if you have to answer, hyoid fracture is more in hanging. Okay. Coming to various forms of strangulation here. This one, where it seems like the person is hugging the other person, but actually not with a good intention to kill that person. So when you see the elbow being used, remember like a hug is mug. Mugging is hugging. Okay, mugging is hugging. When it's a ligature being used, instead of the elbow, it's a ligature used, it is garroting. So remember, ligature used, ligature is garroting. And this image that you see here, this is called as Spanish windlass, which is a modified type of garroting. Spanish windlass, a ligature is used. This is a type of garroting, previously asked question. Look at this one, when it is the bamboo sticks which are being used. Remember bamboo sticks, B-A-B-A, this is Bans Dola. Bamboo in Hindi is called as Bansa. Bans Dola is bamboo sticks. Look at this one, the girlfriend very smoothly killing the boyfriend, right? So smoothly killing is the smothering. Remember this image to remember what was smothering. Smothering is smoothly killing girlfriend using the pillow. So what orifices are blocked here? External or internal? Is the pillow going inside the mouth or the nose? No. So smothering is external orifice obstruction. When it is internal, right? Internal is gag. You put the finger inside, you get a gag. So when it is internal orifice, it is gagging. External is smothering. Okay, external is smothering. And what is burking? What is burking, anyone? So here, if this girlfriend also sits on the boyfriend along with the pillow, then it becomes burking. Okay, so that is smothering plus traumatic asphyxia. Okay, smothering plus traumatic asphyxia, that is going to be burking. Okay, that's going to be burking. So imagine the girlfriend now sitting, that becomes a burking. Okay, that becomes burking. So smothering plus traumatic asphyxia, this is burking, important. And strangulation using the arm and the forearm, this is mugging. Hugging is mugging. Is this clear with everyone? The various images all these tricks, remember, if you are listening them for the first time, you will not remember them if you listen them to once. You have to revise it. That's why I've given you the plan. As soon as the class is over, quickly go through all the tricks so that it stays in your brain. Revise this tomorrow again and then do it a week later. Trust me, if you follow this process, all this you are learning, it will not require any revision, and this will come to your recall very fast in the exam, saving your time. Coming to the sexual perversions, and the examiners are very fond of these sexual perversions questions. I'm talking about the questions, not the examiner per se. You saw this question in the INICET exam also. So this is very, very important. FMG exam also, you'll see a lot of questions on this, and it was in INICET also. Okay? So sexual satisfaction by contact with articles of the opposite sex. This is the articles. So fetching the articles, that is what you remember. Keep saying this to yourself. This is fetching the articles. So fetching is fetichism. Fetichism, fetching the articles. Okay. Next one, of course, this is for everybody. FMG students also, without a doubt, do this. You'll get your 150 along with the PYQs. Contact with other persons to obtain the sexual gratification. That is, contact is the rubbing. So remember, rot and rub. Okay, rot and rub. That is what I was remembering in the exam hall, INICET. Rot is rub. Frotteurism, rot, rub. Dead is necro. Necrophilia is dead body. Necrophagia. Phagia anywhere means eating. Eating the dead body is necrophagia. Love with the dead body is necrophilia. Eon brand ki vest. I'm sure you remember this if you have heard of this mnemonic. Eon brand ki vest. So Eon is transvestism. Vest is a cloth. So wearing the clothes of the opposite sex, giving the gratification. Voyeurism, voila, right? I've seen something interesting. Voila, peeping Tom. So this is called as scoptophilia. Scoptophilia, like, seeing something obscene. Scopto anywhere means that. So, right. So remember, this is voyeurism. This is what IPC this comes under? 354C. Remember, peeping Tom is seeing. Okay, peeping Tom is seeing. So remember, that is basically voyeurism. And then you have scotologia. Remember, logia jahan pe bhi aayega. Logia matlab language. Logo, language. Remember, log, language. Using obscene language is scotologia. Okay? Next is that bestiality. Remember, beast is animals. Okay, beast is animals. So bestiality is animals. What is a sadist? A sadist? Sadism. Someone gaining pleasure by inflicting pain on others. That is a sadist. Okay, that is a sadist. So the INICET examiners were sadist by putting such a paper. So that is sadist. Oh, very good. So we had a bingo moment on that. Whoever thought that. Masochism is कि खुद पे pain लेके जिनको मजा आता है. They are machos. So masochism means we are machos, kitna bhi pain do, but we will enjoy it. So this is self-pain. So masochism is like these are macho people. We enjoy the pain. Okay. So this is sadist and this is masochism. Okay. Coming to this again was a very, very frequently asked. That is so superfetation and superfecundation. Okay. Superfetation and superfecundation. So superfetation, as the term says, ek fetus ke upar. I know that some tables are not there in the PDF. They are added at the last minute where I thought, no, this is something I should include. So I will share the PDF again. You can add the points there, or you will also get the PDF in the app also. Okay? Superfetation, superfecundation. What is the difference between two? Superfetation, but the fetus is already there, and after that, a second fertilization is happening. This is superfetation. Superfecundation is, remember, C-U-N, fecundation. C-U-N is cycle uni. Okay, cycle uni. In one cycle itself, but there are two different ova. Okay, so fertilization of two ova within the same menstrual cycle, but not at the same coitus, right? And not necessarily by the same male also. So I'll tell you the question which has been asked previously, how the question was framed is. So a female gave birth to two kids. but the father said कि नहीं ये बच्चे मेरे नहीं हैं. So the paternity test was done. Out of that, one belonged to that father and one did not belong to that father, right? So both are born at the same time. That means it was done in the same cycle. But belonging, or one is from the same male, one is from the other male. So that is an example of superfecundation. Okay, that is superfecundation. Is this clear with everyone? Yeah. So this is superfetation, unproven to occur in humans. So superfetation nahi hota. Next one, coming to autopsy types, very, very important. 2 questions in NEET PG from that one, this chota sa table. You never know what is the examiner fond of. Sometimes sexual perversion, sometimes autopsy, sometimes something else, right? So remember that one by one, if the organ is removed, one by one, remember this is Virchow, that is Virchow. One by one is Virchow. So first that we generally open is the cranial cavity. Okay, the cranial cavity is generally opened the first. Block dissection, that is one cavity at a time, ki puri cavity saath mein nikalo, not organ. So you are focusing on one cavity. So remember, Ghon's focus. Ghon's focuses on one cavity. Ghon's focus. NC2 is Rokitansky. Rokitansky, INST is NC2. When do I want to do NC2? I don't want to get the organs out when there is infection spillage risk, like with HIV. Your recent NEET exam question. Then is NMAS. You remove the entire from the head to the pubis, pura pelvic organ saath mein. NMAS, all the organs. So this is the fastest. No time. We want to do it all together. Why do one organ, one cavity? So it is like le tu le, pura le le. Upar se niche pura le le. So that is le tu le. So remember, it is not actually le tu le, but for a mnemonic, we read it as le tu le. Pura le le, upar se niche le le. So that is NMAS, le tu le. The routine incision that is done for autopsy is what incision? The eye. Remember, incision starts with eye. So the routine is the eye. The other that you have is the Y-shaped and the modified Y-shape. The Y-shape is for a better cosmetic one. In Y is below the mammillary line. Okay, below the breast fold. Last cavity to be opened in asphyxia. What is the last one to be opened in asphyxia? Important. It is the neck. Why do you open the neck at the last? Remember, the sequence in asphyxia is C10. What is C10? That is cranium. Then it is thorax. Then it is abdomen. And the last to be opened is neck. So remember, it is C10. Okay, that is C10. Why do you want to open the last? Last is the neck, because we want a bloodless field. We do not want the blood from the other areas to come in the neck. So we cut off all the blood supply from all the cavities first, and then we open the neck. And we have modified Y incision is what we use in asphyxia. Okay, remember that point. Newborn का बता रही हूँ, जो क्वेश्चन आया था INICT में, क्या था? न्यूबॉर्न में, राइट, लाइव बर्थ है, डेड है, उसमें होता है फर्स्ट इन द न्यूबॉर्न it is abdomen first to look for diaphragm, the position of the diaphragm, right? If the baby was live and the baby had taken a breath, the diaphragm will go down, right? So first is abdomen to look for the position of the diaphragm. Okay? Next one, preserved in strychnine. Remember, SS, strychnine is a spinal poison. So you will preserve the spinal cord. Metals go into the bones, we said. So for heavy metal poisoning, you preserve the nails. And when you are preserving the organs, what is the most common solution that you use for preserving the viscera? Inverted Y is done in infants. Yes. Never use formalin. Never use formalin. It is saturated salt solution. It is saturated salt solution, which is most commonly used. Ideal one is ethanol, the rectified spirit ethanol, which is the ideal one. But most commonly used is saturated salt solution. You do not need anything to be added for bones, hair, nails, and even for the lungs. Lungs जब preserve कर रहे हो, bone, hair, nail preserve कर रहे हो, इनके लिए कुछ नहीं लगेगा. Formalin use नहीं करना. Okay, formalin is not used. Saturated salt solution is used. Okay. And what do you use for blood? ब्लड के लिए क्या यूज करते हैं, जो हम ग्रे वैक्यूटेनर में यूज करते हैं, ग्रे वैक्यूटेनर ग्लूकोज वाला, सोडियम फ्लोराइड प्लस पोटेशियम ऑक्सलेट, एंटीकोएगुलेंट, ब्लड के लिए एंटीकोएगुलेंट लगेगा, सो सोडियम फ्लोराइड पोटेशियम ऑक्सलेट, ठीक है। ये विसरा प्रिजर्व करने के लिए है, दिस इज बेसिकली फॉर प्रिजर्विंग द विसरा, राइट। So this is about this one. Coming to the test for the live birth, might come in your exam. So test for live birth, remember the names: Redden's test, breast loss test, Fortier's, Plockett's, hydrostatic flotation test called as Regards test. I'll tell you how to remember all of this. So Redden's test, similar to Weber's. You know, Weber's we do for the ear. So in the Redden's, you are testing for air in the middle ear. In the breast loss, this is for air in, remember breast loss is S, so air in the stomach and the duodenum. Okay, remember this is breast loss, stomach wala kaun sa hota hai, the second life test. Okay, the breast loss second life test. Okay, next what we have is nails ke liye kuch nahi lagega, bone hair, nails और lung ke liye. Fortier's test and Plockett's test, this is basically for the weight of the lung. Weight of the lung is remember stillborn and liveborn. With if it is liveborn, the weight of the lung increases or decreases. The weight of the lung increases with liveborn because of the circulation, the blood coming into the lung, the weight increases. And Plockett says the same thing. The difference here only is Fortier's is the absolute weight, you weigh the lung, and Plockett's is proportional, P for P. So weight of the lungs to the body, you are taking the proportion 1:70 and 1:35. So remember, Plockett's is proportional, Fortier's is full weight, absolute weight, Redden's is Weber's ear, breast loss is S, second life, stomach wala air. And hydrostatic flotation test, which is also called as Regards or dosimetry, the lungs float if the child has taken a breath, right? So this is flotation test. Okay, this is flotation test. The fallacies are, sometimes the baby has taken a breath, but the lung will sink down. So remember, where do you get false negative and where do you get false positive? False negative means we have got a negative result. The lung is not floating, but actually the baby was live. So when there's pneumonia, edema, alveolar duct membrane, so here the weight is increased due to consolidation, due to edema. So it will not float. And unrespired lungs may float, false positive. So remember, putrefaction because of the production of gases. Artificial breath diya hai baby ko. This will give false positive. So important, remember what is false negative, false positive. False negative means it's a heavy lung due to edema consolidation. And false positive means it is air present. So putrefaction, artificial breath. Is this clear with everyone, the test? So test for the seminal and the blood stains. So very, very important one point that I want you to remember, this has been asked many times in the exam, is basically कौन सी टेस्ट करते हैं to identify that the stain belongs to the human species. We are not talking about whether it is semen, it is blood, it is what. We are just saying that ये human species का stain है. It is not animal. What is that? Very good. It is precipitin. Okay, it is precipitin. Precipitin precipitates the human proteins. So remember, human proteins, precipitin test is for the species. This has been asked in the exam many times. Please remember this point. Test for semen and test for blood. What are the tests for blood? What is the mnemonic for the test for the blood stains? Benzidine. Then you have Kastle-Meyer test. Then you have Takayama, Tickmans-Hemans test, and spectroscopic test. So the mnemonic to remember this as he-man who wears a spectacles. He owns a castle. Where? In Takayama. Where does he have a castle? In Takayama. So remember, he-man, Tickmans-Hemans test. Then you have spectroscopy. Then you have Kastle-Meyer test. And you have Takayama test. Of course, benzidine, BB is for blood. Benzidine test is also for blood. Okay? The test for semen, पहले ये वाली देख लो जो बहुत बार आई है एग्जाम में, very, very important. Florence and Barberio's. Very easy trick to remember is Florence Remember, fluorines is fluoride. Remember all the halides, chloride, iodide, bromide. So fluorine, chlorine, iodine, bromine. बस इतना याद रखना है. So fluorines test में it is choline that we are detecting. We are detecting choline. What are we detecting here? Is choline in the semen. Iodine is the reagent used, iodide wala, and bromine is brown rhombic crystals. It gives this brown rhombic crystals. While on the other hand, barbados, imagine someone going to barber and getting a needle prick while shaving. So barber gives a prick, needle prick. So remember, prick is picric acid. What are we detecting here? It is spermin. Okay, this is spermin. तो क्या हो गया बार्बर के वहां जाके? Spam हो गया, right? It's a spam, it's a scam. So spermin, barber does a spam. So remember, it is spermin in Barbados, picric acid and needle shape is what you get. So look at the images when they give you this image-based question. Brown, rhombic, bromine wala is fluorine wala fluorines test. When they give you this needle shape, that is prick caused by barber, that is Barbados. Okay, that is Barbados. Is this clear with everyone? Yes, amazing. So that's another mnemonic you can use. He-Man went to castle in Benz. Right? He has a car, he has a castle, and he has Benz, Mercedes-Benz. Right? So blood ke hai castle mein your He-Man's crystal is for blood. Now one test in the blood which can look similar and to your the fluorines test, which also gives the brown rhombic color. Remember the blood test jahan ye brown rhombic aata hai, that is what test? Takayama test. Okay, the Takayama test is like fluorines test. Okay, that is like fluorines test. Right? So this is how you'll get. It can give pink or it can give brown. So this is one point that I wanted to highlight. Agar blood test mein bola brown rhombic, so remember that is Takayama. Okay, that is Takayama. The test for the semen, also remember, now we were talking about the bends, also remember SUV. What is SUV? And what color SUV do we have? We have blue color SUV. We have blue color plasma TV. We will come to that in physiology. Evans blue is plasma. Blue is SUV. So remember, blue with ultraviolet is semen. If they tell you that with ultraviolet light, blue fluorescence is seen, what is the specimen? Is it blood? Is it semen? Is it semen? So blue SUV. We do acid phosphatase test, not alkaline phosphatase test. And we can do the CPK also, right? What all is present in semen? You can do CPK, you can do acid phosphatase, Barbados, fluorines, and prostate specific antigen. Clear with everyone, the semen test and the blood test? Going to next one, the types of wounds, right? This one, which is just a kharoch, jo bolte hai scratch ho gaya, kharoch ho gaya, that's basically an abrasion. The type of abrasion where you see the marking, the imprint which is there, this is called as pattern or imprint abrasion. So for example, these tire marks, okay, that is pattern or imprint abrasion. Then you have incision and laceration. Incision. When do we do incision? During surgery, do we do incision or laceration? What does the surgeon do? A skilled surgeon will always do an incision, not a laceration. So remember, we talk about surgical incisions, not surgical lacerations. So that helps you to remember that in surgery, we do incision. That means it is more sharp and it is more regular. It is not meant to be irregular. Opposite of that is laceration. Incision mein, you will see the tail which is there, which helps you assess the direction, and it goes from deep to superficial, right? So this is how the direction goes. You will see the tailing. It is the deep to superficial. Okay, so the tailing is seen. Do you see tailing in laceration, guys? Do you see tailing in laceration? Yes or no? Very good. Amazing. So remember, laceration also shows tailing. But what tailing? This is a previously asked question. That is a swallow tail. Okay, the split tail, the swallow tail. Remember, this is tearing at an angle. This is seen in laceration. So swallow is seen in laceration. So let me quickly summarize the tailing here. If it's only the tailing, it is incision. If they give you in the question swallowtail, remember swallow, LL, this is going to be laceration. And which other tailing is there? एक है swallow और दूसरा कौन सा है? Fish. Absolutely right. Remember, fish has only S. Do not get confused between swallow ka S and fish ka S. Swallow mein there is LL also, so this is laceration. In fish, it is only, or you can remember, this is SH, which is a sharp. Okay? A sharp weapon will give fish tailing, which is stab. Sharp is fish. Single edge या double edge, किसमें मिलता है? Sharp weapon with a single edge. Because if it is a double edge, what do you get with double-edged sharp? Double wala is like this. Okay, that is going to give spindle shape. So look at this very, very important image-based question here. A double-edged will give spindle shaped. Okay, right? That's going to be V. So V and V. So remember, double-edged is like this. It gives a V and a V that becomes a spindle. A single edge, a single sharp edge will give the fish tail. Wedge shape, teardrop, fish tail is what it can do. So V is only one end. Okay? Clear with everyone? So fish is sharp one edge, swallow is laceration, only tailing incision. In laceration, what is present is the tissue bridging. You would see the tissue bridging, like the question mentions the hair bulb vagera dikh raha hai, it is irregular, that will be seen in laceration. This one where the skin is intact, the epidermis discontinuity nahi hai, but you see the discoloration, that is contusion. Remember, contusion shows what happened here, right? Contusion shows the color change. Contusion is a bruise, right? It's a bruise. The other name, it is skin intact. So like beating with a lathi, that will give a contusion. Okay? And what do you see? Do you see a bruise in blast injury? What is the Marshall's triad in the blast injury? Marshall's triad in blast injuries has what 3 injuries? Previously asked question. Abrasion, contusion, laceration. What is not there? Fracture is not there. Fracture is not there. So remember, Marshall's triad is for, first remember this is for blast. And remember the mnemonic is also BLA. There's a bruise, there is laceration, there is abrasion. Okay, blast ka BLA. Bruise, laceration, abrasion. What is not there? Previously asked question. Fracture is not there. Okay, fracture is not there. Right? Coming to this one, this has been asked in FMG exam also, where you have a very heavy weapon and it tells you that heavy weapons hai, and you can see the underlying muscles, the vertebra, very deep hai. Heavy weapon going till the deep, like the bones, the vertebra. This is called as chop wound. Okay, chop wound, H for heavy weapon. Chop has heavy weapon and goes deep till the muscles or the bones. So like the neck mein hoga, jahan pe muscles zyada hai. And this is a stab wound. Stab is basically with a sharp weapon. We said that it is fish tail or it is spindle shape depending on single edge or double edge. Okay. So this is about the types of wounds. Going to ballistics, the firearm injuries. What range of wound is this? What range of wound is this? Contact. Okay, coming to your incised looking laceration and laceration looking incised wound. So when the question is incised looking laceration, so it is a laceration but looking like an incision that happens at the forehead, the bony prominences, shin vagera. And if it is a soft areas like the ear lobule, so scrotum, even if you take an incision, because of the loose skin, it will appear like a laceration. So laceration looking incised and incised looking laceration. Remember, it is bony and soft. Okay, यहाँ पे सब sharp होगा क्योंकि कोई soft tissue नहीं है. So everything will appear like a incision. So incised looking laceration wound is going to be on forehead. Okay, the bony prominences. This one here is the contact shot because it has the stellate or cruciate. Stellate or cruciate is the contact shot. The rest of them are circular. Okay, the rest of them are circular. Only this one is stellate, that is the contact. Okay, that is the contact. Now, which is the one which has everything present? It has SBT or BBT all present. What range wound has all present? Close. Remember, it is close. Close short is close to everything. It wants everything. Close and dear to everyone. So remember, close is close to everything. So it has SBT or BBT all present. The singeing, the blackening, tattooing, all is present. Okay. And in the near shot, what is the hallmark of the near shot? Remember, near, N-E-N-I. So near shot is like Nikita's mnemonics stay in your brain like tattooing. Tattoo. Tattooing is the hallmark of the near shot. Tattooing. What is tattooing due to? Burnt or unburnt powder? What is tattooing due to? Unburnt. Remember, tattooing is unburnt. T-U. It is T, alphabetically T-U. Tattooing is unburnt. Can it be removed? No. The mnemonics, Nikita's mnemonics like tattoo cannot be removed. Tattooing cannot be removed, right? And what is blackening? What is blackening? Blackening का दूसरा नाम क्या है? Remember it with black smoky kajal. You know, that is how the advertisement comes. The black smoky. So remember it is because of the smoke kajal. But when you put that kajal post advertisement and you see that, it gets all smudged. So it is also called as smudging. So remember it with kajal. The eyes make kajal. Blackening, smudging is smoky eyes, smoke. It is because of smoke. Smoke comes when it is burnt. The burnt powder gives the smoke. है ना? हाँ. लगाने के बाद मालूम पड़ेगा कि पूरा smudge हो जा रहा है. So this is about your blackening, tattooing. Singeing and scorching is because of the flames, right? When it's a contact shot, it's a close shot. जब पास में से shoot करोगे जो fire निकलेगी, that fire, the flames will give the singeing and the scorching. So close is close to everything, right? Near has tattooing. Collar is present in all of them. Okay, remember collar is present in all. In the contact, in the distant, everywhere you would see a collar. Okay? Right. So this is about the ballistics. Remember, if they are giving you this image and they are giving you, this is the image of a close shotgun, a close pistol, a distant shotgun, or a distant pistol. So is it a rifle or is it a shotgun? How do you know that? ये shotgun है कि ये rifle है. Very good. So remember, when you see the pellets like this, okay, when you see the pellets, where do you use the pellets? In the shotgun. So this is a shotgun. Rifle will give one mark, a circular mark. ठीक है, उसमें से bullet आएगा. Rifle में से bullet आएगा. Shotgun में से short pellets आएंगे. So remember, shotgun has short pellets. When it is completely dispersed like this, you are not seeing the primary any circle wound. Completely dispersed. Remember, dispersed, D-I-S-G-I-S, is a distant shot. Okay, that is a distant shot. So this is what you are seeing here. Where do you see the rat hole appearance? Mid-range or near range. Okay, mid-range or near range. Close is close to everything. Okay. So you start seeing, this is where you have this one. Look at the shotgun. Okay, look at the shotgun. Contact is stellate, close has everything. Near is the one, read near ulta. This becomes the rat hole appearance, right? The irregular margin. This is 1 to 2 meters. Intermediate TE has satellite. So you would see the satellite jaisa appearance. This is 2 to 4 meters. Remember, 2 is die. So the dispersion starts at 2 meters. So that is the satellite, is the dispersion, and the dispersion completes at 4 meters. That is a distant shot. So for the shotgun, remember the distant shot, D is the 4th alphabet. So it is more than 4 meters. Okay. More than 4 is distant. Less than 1 is close. Close is less than 1. Distant is more than short. In between is your mid-range, which has near and intermediate. Near is rat hole, intermediate is satellite. Okay. So this is what is shown here in the image. Okay. This is what is shown here in the image. This is the rat hole appearance and the satellite appearance. Satellite is intermediate. Okay, satellite is intermediate. Okay? Going to the next one, and for your rifle, the distance for the rifle is basically distant is more than 60 centimeters becomes distant, 30 to 60 centimeters become near. Remember, the distances are different. For rifle, it is more than 60 centimeters. For shotgun, it is more than 4 meters, right? Otherwise, the rest of the things remain the same. Okay, the rest of the things remain the same. Out of this, the most frequently asked one here, ये satellite वाला बहुत commonly आता है. Okay, satellite वाला common आता है. Look at this image here. These images are not there in the book, so just have a look here. When in the rifle one, you are given this appearance here. What is this appearance here? This peppering, this is called as what? This is called as tattooing, which is also called as peppering, right? Tattooing is present in close, everything is present, and in intermediate also. So along with that, you can see the black wala appearance along with the tattooing. So this is going to be close range. When it is just the peppering, you are seeing not a lot of blackening you are seeing there, right? So that is going to be your intermediate or near. Remember, intermediate and near is the same. Okay? Is this clear with everyone? When you have only the collar present, right? There is only the collar present, that is going to be a distant. Okay, that's going to be distant. Contact is going to have the singeing vagera present. How to know it is tattooing or it is satellitism? See, this is because of the gunpowder. While in the satellitism, it is the pallets. So they are going to be more well-defined and more black is what you will see. Otherwise, इनका दोनों का range same है. Both are intermediate. That is the best part. कि satellite दिखे या tattooing दिखे सिर्फ, so that is intermediate. Okay? Right. Going to the next one. Is this clear with everyone, guys? The distance range, I hope this is clear with everyone. All you have to remember, close is close to everybody. You will see SBT, all of that in close. And in your near one, near Nikita's tattoos peppering jaisa dikhega. In your shotgun, completely dispersed is distant. There's no primary wound there. And if it is the rat hole appearance, then it is near. If it is satellite, it is going to be intermediate. Near and intermediate, many books keep it as same also. Okay. Coming to this one, the important one-liners based on the previous year questions. The various rules in FMT. Hassay's rule, Nisten's rule, Pappe's rule, and Ashley's rule. Hassay's, remember it as F, G, H, alphabetically, A, B, C, D, E, F, G, H. So Hassay's is G, F, G, H, gestational age related. G, A. So remember, this is fetus gestational age. F, G, H is Hassay's rule, right? It is square root of 5 or it is divided by 5 when the CRL is given. Okay, when the CRL is given. Next one that you have is Nisten's. Remember Nisten's again alphabetically M and N. For the rigor mortis, it is Nisten's rule. Okay, for the rigor mortis, it is Nisten's rule, which tells you that in what sequence the rigor mortis will appear. First is involuntary, then is voluntary. So look at the options carefully. If you have the cardiac muscle and you have the eyelids, both in the option, first will be cardiac. This is your previously asked question. Okay? That is rigor mortis. Do not confuse rigor mortis with cadaveric spasm, instantaneous rigor, where there is no primary relaxation. Again, a previously asked question. You do not see any primary relaxation in cadaveric spasm. And you see it in what cases? A person drowning holding on to the weeds. So this is seen in ante-mortem drowning. Okay, that is seen in ante-mortem drowning, right? Coming to next, Pappe's rule is for the skull fracture age. When you have multiple fractures in the skull, right? There is one fracture, there is second fracture, there is third fracture. So if I label these fractures as 1, 2, and 3, and I ask you that which of these is the oldest fracture out of the 3, you can get an image-based question. Which is the oldest? The one which has crossed everybody, right? So this has crossed beyond this point. This fracture point, it has gone beyond that. This is the oldest fracture. Okay, that's the oldest. The one which has crossed is the oldest fracture. That is Pappe's rule. Okay. Hass's, Nistens, Pappe's. Ashley's SS. Remember, this is to identify the sex using the sternum bone. This is not for the race or the age. This is for the sex sternum bone. Cephalic index CE, remember, is used to identify, determine the race, not the sex. Cephalic index is for race. Best bone for determining the sex of the individual is the pelvis. Okay, female pelvis, male pelvis, the best is the pelvis. Just understand this concept that a female pelvis is a pelvis which needs to be more wide because a female pelvis has to give birth to a child, right? So you will see the circular pelvic inlet. You would see the pubic arch ka angle which has to be more. The ischial tuberosity should be everted so that the space here is more, right? The sacral promontory, should it be more prominent or less prominent? If the sacral promontory becomes more prominent, the space will decrease. We do not want a prominent promontory, so it is less prominent. So ऊपर ये straight रहेगी, फिर ये curve होगी, so less prominent. The greater sciatic notch, which is the best, it has to be wide so that the space increases. Okay, so all these are the points. This is all logical to remember male pelvis versus female pelvis. Best for identification is the fingerprint. Okay, best for identification is fingerprint because even the identical twins will not have the same fingerprint. They will have different fingerprint. So there was this one question which said that which of these will not be same? DNA fingerprint same hoga. Ye wala fingerprint same nahi hoga. Identical twins mein. Next that you have, the most common fingerprint is a loop. Remember, loop keeps appearing on a loop. Like you listen to some song on a loop, something which you like. So it reappears again and again. So loop is on a loop. Okay, loop is on a loop. Gastric lavage is not contraindicated in which corrosive poisoning? Very important, carbolic acid. Remember, carbo is carbo. Carbo. Kya carbo? Gastric lavage carbo. Karo gastric lavage in carbolic acid. Okay, in carbolic acid. Yes, leathery stomach. Very good. So that is carbolic acid gives leathery stomach. Next one that you need to remember is the acid versus alkali. Which one is more dangerous, acid or alkali? Which one causes more depth of the wound, acid or alkali? Very good. You guys know everything. It is alkali, right? So alkali causes liquefactive necrosis or coagulative, right? So remember, alkali is L. It causes liquefactive necrosis. Acid is C. It causes coagulative necrosis. But the exception here is important. Remember, except which acid which causes liquefactive? Remember, hydrofluoric. Hydrofluoric acid is like fluid. Fluoric is like fluid, liquid. It causes liquefactive necrosis. Okay, it causes liquefactive necrosis. Right? So that is HF, hydrofluoric acid. Alkali is liquefactive, more depth is what we need to remember. Leading questions are allowed in cross-examination. What do you mean by leading questions? Where the question asked is yes or no. Yes or no questions are basically leading questions. It is in the cross-examination, right? And what is the time limit for cross-examination? How much time this leading questions can go on? How much is the time limit for cross-examination? Koi limit nahi hai. There's no limit, right? So we only have limit for our studying focus and concentration. Ye cross-examination वगैरह में वहाँ पे कोई study limit नहीं होती है, time limit नहीं होता है. There's no time limit for cross-examination. Okay, so leading questions are allowed in cross-examination. Consent to be given by guardian if the child is less than 12 years. In case of rape, it is less than 18 years. And if it is you take a consent someone, rape वगैरह में 18, बाकी otherwise जो surgery procedures हैं उनके लिए 12 years. ठीक है? And remember, if you take a consent from a child who's 10 years old, it becomes an invalid consent. Invalid consent is what? IPC 90, 0 value, no value. Death and freshwater drowning. Remember, F for F is fibrillation, ventricular fibrillation. Freshwater is when it's a lot of liquid coming in. So there is all dilution happening. So there's going to be hypokalemia, hyponatremia. Salt water में salt आएगा, sodium chloride आएगा, hypernatremia होगा. Salt वाले में there's going to be hypernatremia. Okay, there's going to be hypernatremia. And do not confuse this here. Filigree burns. Where do you see filigree burns are because of Li. Filigree burns are because of lightning, and they are also called as Li. They are also called as Lichtenberg flowers. Lichtenberg flowers. Lightning, Lichtenberg, filigree. Filigree burns, remember, they can look similar to marbling that occurs post-mortem. The marbling is blue color because of the self-meth hemoglobin, and it occurs 36 hours after death, right? So these are the points. I think one more image that I've added for male and female pelvis. If you are asked the image, the one which has the inlet which is more circle and the inlet which is more heart shape. Remember, deep transverse arrest is common in which one? Android pelvis देखा है, जिनका दिल लटक जाता है males का, they are heart shape. Android pelvis, heart shape. This is circle, goal gynecoid. From obstetrics, we have read this. Goal gynecoid, and males android, they are heart shape, deep transverse arrest होगा, अटक जाएंगे किसी के ऊपर, right? So this is female pelvis and this is male pelvis. The sciatic notch is more wide and the promontory is less prominent. Okay, so remember these points here. Prominent ischial spine किसमें होगा? Again, think logically. अगर ischial spine prominent हो जाएगी, तो pelvic cavity कम हो जाएगी. So that is going to be in male. Whatever is decreasing the size of the pelvis, that is going to be android. So the angle is less here, the angle is wide here, the pubic arch angle more in females, less in males. Okay. So this was about the FMT short revision, guys. You do have some queries whether this is enough. This covers the majority of the stuff, the most frequently asked stuff, something that you cannot make wrong in the exam, right? Please complement this with the binge revision videos for whatever subjects we were able to do. We had done it for INICET, but that is extremely important for your NEET PG and FMG also. So for example, the post-mortem changes has been taken in the binge revision with the graph of alger mortis, rigor mortis, PM lividity, right? All that, how do you identify in the graph? It's an important graph. Please watch it from the binge revision. Few more important videos that I would like to suggest. Bone age estimation. I'm sorry, I could not take it here. It is there in the main videos with all the tricks, like, you know, bone age kaise identify karoge. There's this N-shaped trick here. Shoulder per responsibility you take at 18 years, right? So all these tricks have been discussed there. So bone age estimation or binge revision, at least ye dekh lena from the binge. The bone age is present in the main videos. In the new app, the main videos is labeled as HYT. High yield topics is basically the main videos wala folder. The extra topics over and above the short. We have only included in the high yield topics, the extra topics over and above the short. If any of the short topic you want to read in detail, you can see it in the new app with the short topic wise wala jo folder at first. There I've discussed it topic wise and in a more like aram se. Okay, so you can, if you want to do that, you should do that, otherwise skip that. So please do the binge revision and also the PYQ discussions that we have had. In the new app, you will find all the folders of a particular subject in that subject folder itself. Okay, so how to get the new app, guys? Whoever was there on the previous app, the Speed MedSynapse app, we have activated your registrations there. So just register on that app. Your course has already been activated. Please do not repurchase or repay. You don't need to do that. Okay, till that time your subscription was active, it will be active there also. Realize someone had mentioned freshwater drowning is hyperkalemia. My bad there. It is hyperkalemia because of the dilution. There is RBC lysis. So the potassium comes out from the cell. It is hyperkalemia. Please make a correction there. It is hyponatremia. I meant to say it was hyponatremia, not hypokalemia. Salt water mein there's hyponatremia. In fresh, it is hyponatremia, hyperkalemia, and leading to fibrillation. Fresh is fibrillation. Okay. So yes, that was about the today's session. All right. Thank you so much, everyone,